Welcome to Dizzy Therapy. I'm Anthony Veglia, but a lot of patients call me Doc. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. Isn't it normal to be more off balance and dizzy as you get older? Well, let's talk about aging, balance, and dizziness. There are two big misconceptions here. One is that balance is worse simply because of getting older. And the more serious of the two, in my opinion, people will accept dizziness simply as a part of aging when they really shouldn't. Now, dizziness can be caused by many things. Some are actually more common in children. Some are more common, yes, as we get older, and some are really common middle-aged. But dizziness is never normal at any time in our lives. For a few examples, vestibular migraine is a diagnosis that's much more common in teenage years and the 20s. BPPV is much more common 60 plus. Perilymphatic fistulae really commonly is diagnosed when you're a child, and Meniere's disease, well, that's a middle-aged diagnosis. These examples show that age alone would not be the guilty culprit, but instead we need to look at the individual cause of the dizziness, which is related to age, but not just from having too many birthdays on board. Dizziness at older ages does have a more serious consequence though, as something like a fall can be much more damaging. But that's why we really need to discuss balance as well, as the two are very linked. The inner ear is where movement and orientation are sensed. The nerve from the ear to the brain carries the information. The brain uses that information to tell your muscles what to do to keep you upright. Now, the brain and muscles do see decline with age, which is inevitable. However, balance and stability is a complex mesh of multiple senses, our experiences, our attention, the actual task at hand, and the muscles that make it all happen. So if we want less dizziness or greater stability, we can manipulate any of those in order to improve. A simple adjustment like glasses can improve one of our senses immediately. Practice gives us specific experience, and other exercises like resistance training improves our muscle strength and speed. While senses and muscles are a lifetime battle to care for over time, experience actually increases with aging. If we think of an ice skater spinning full speed, which is crazy, they're not born like that. They had to spin, get dizzy and fall over, spin, get dizzy, fall over again and again. But eventually, they don't get dizzy and they nail it. But their ears, eyes, muscles are not unique. Their brains had to learn over years of practice. I've treated many patients well into their 90s, and the big secret of balance is this. If you want to keep moving, keep moving. Most of the exercise routines that I give as a vestibular physical therapist, treating patients with dizziness and imbalance, are 5 to 10 minutes, more or less, depending on a patient's needs. Maybe they struggle getting up the stairs, playing pickleball, picking up grandkids. I've got a few folks that are really into jazzercise. But there is never an age where the brain and body are unable to improve. Never. As early in life as possible, though. Get exercising, get your muscles strong, and keep them strong. Build experience at balancing well. The great news is you are in control, taking charge of your own health. Another part of health to take charge of, especially for the older adults, is polypharmacy, as in too many drugs. A common issue, sadly, that can cause dizziness is when a person is taking too many medications at the same time. Dizziness is the single most common side effect of all drugs, and when a few medications combine, the chances go up even more. So, if dizziness, imbalance, or vertigo is a concern, don't blame age alone. Get control of it by visiting your doctor to manage those medications an ENT for a potential inner ear diagnosis, and a physical therapist for treatment. Discuss your prescription drugs. Get tested for balance performance. Get a diagnosis as to why you have dizziness or vertigo. Maybe it is from medications you no longer need. And get moving with your physical therapist to overcome these concerns. When it comes to exercise, if you don't have the time to be healthy, then you definitely don't have the time to be unhealthy. Take charge of your health. Find the help you need to get started. Thank you so very much for watching. Always stay curious about these incredible bodies that God has designed for us so well. Leave a question in the comments below because I would love to know what you all want to learn. Subscribe to Dizzy Therapy for more videos in the future. And remember, dizziness, imbalance, and vertigo are never normal. So visit your ENT and vestibular physical therapist as soon as possible so you can get back to moving freely. Have a great rest of your day and may God bless you with stability throughout your dizzy therapy.